all of our support groups, churches have them. They have to be sponsored by a church. They have to be, or a ministry. Like for instance, a clinic could have them, or a hospital. But somebody has to be has oversight. They don't meet in people's homes or things like that. Thirdly, they are ongoing. It's just like AA. There's short-term interventions that are done by some organizations. There's one out of Texas called the Grace Alliance. They're friends of mine. Their material was written by a psychologist and a man whose wife had bipolar disorder. And short-term intervention works initially. Short-term intervention means like they have a 12-week course or a 12-week group. And so when people get done, they have new information, they have new tools. But if having a class on recovery was all it took, AA would have been doing this a long time ago. That's not how people learn, but it sure is how the church likes it. We like little things that start in September and end in November. You take time off for the holidays, you start again in January or February, and then you go till Easter, spring, and then you take the summer off. Well, that's not how mental health challenges work. And in fact, I always tell our teams, you need to be having it every week, and you need to have it during the holidays. Not necessarily on a holiday, but during the holidays. Also, we're the only support group system in the United States where our groups are made up of loved ones and those with a diagnosis. If she were my wife, which she's glad she's not, but if we went to a meeting together and she heard Katie make a statement that I've made before, but she hears Katie make it in a new way about bipolar disorder, she's going to hear it. And we've had people help. There's a cross-sectioning that happens. Our second half of the meeting is everybody breaks up. We have team groups. We we do trauma healing with groups out of the Healing Institute, which comes out of the American Bible Society. And we also then have we just started a pilot program with a support group for people who have lost loved ones to suicide. And also then I've been working in our county jail, and we have living free groups, and they're for people with dual diagnosis. And you know, I tell everybody, even on this panel, everybody got emotional issues, and if you think you don't, I have the spiritual gift of triggering people. I will come and live with you for 24 hours, and I will reveal where you have emotional issues. I just came from it naturally. My father was very good at it. I'm very good at it. My sister's even better. But quite honestly, emotional issues, everybody's got them. If you got the brain chemistry thing on top of it, it gets a little more complicated, okay? So anyway, that's what Living Free does, is deals with those. And if churches want to have a real strategic ministry with the homeless and with the jail ministries, if they want to be strategic in that, that would be a way to do it. We are also now on the process of starting, and I don't know how much you followed this, Katie, or know about it, but we're in the process of, we're about halfway through creating what we call Hope Coach training. And Hope Coaches, if any of you have ever heard of Stevens ministers, it's not like a Stevens minister. A Stevens minister in a church would be, they might visit grandma in the nursing home and help that way. Hope coaching is for people who are going through a crisis, feel hopeless, and these folks will be trained to do three things. Listen, 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 no judgment, listening. Secondly, knowing strategic questions to ask to help pull the pain out of people, to help them process their pain. Thirdly, how to then speak from a clinical perspective and a practical way hope into that situation without giving somebody toxic positivity, which is really a problem. There's a lot of toxic Christianity out there. Then we are going to be hopefully designing Hope Navigators. And Hope Navigators could actually work on people's staffs, or they could be volunteers. The Hope Coaches are all volunteers, but a Hope Navigator would be somebody such as what is your name? No, Katie. I was going to call you Perry. I'm thinking Katy Perry in my head. See, I told you my brain wasn't fully on tonight. So in that process, somebody would be trained and certified as a peer support specialist, which are actual positions that states now offer and have, and Medicaid is even beginning to pay for in most of the states, because it's cheaper and it's as effective. And secondly, not as effective, let me phrase that a different way. It can be as effective, and it's cheaper, and states are, willing to throw a little more money at it, knowing they're going to get a lot more for that money. But this person, a Hope Navigator, would be trained as a certified peer support specialist, a wellness specialist, as well as a Hope specialist, and they would have to have lived experience. But they could be on a church staff, they could be a volunteer, there could be 3 or 4 of them in a church or whatever. And nationally, there's a number of us that do this, such as myself, Matt Stanford, and others, where we're working on putting that together so that churches don't have to figure that out. And so this we call this our 411 sheet. And then the resources, we tell clinicians in every region where we have groups that what the groups are. We have it in Spanish, we have it in English. You can attend an online group if there's not a local group. We have the #1 Christian mental health podcast on iTunes. We have 69, I can never remember. I'm not a numbers person. Groups across the United States in 25 different states and 4 different countries. And
is this the name of your mental health podcast?
Yep, it's Fresh Hope for Mental Health. It's the podcast.
Very cool.
And this sheet has all the stuff on there. And we interview people for our podcasts. Like I'll probably get a hold of some of these folks and do a podcast interview with them. And we interview peers who are living well. For instance, I really promote Katie's blog as much as I can, and I created a group the other day because from a national perspective, when the pastor out in Southern California committed suicide or died by suicide a week and a half ago, and he had a ministry for people going through depression at Greg Laurie's church. It broke my heart because no one, especially, but pastors deal with so much stuff. He may have this really great church here, but let me tell you, it's hard being a pastor. It is. And now that I'm not one, I can talk about it. But let me tell you, the thing is that the voices of those who have a diagnosis that are living well is seldom heard. It's like going to, I spoke at Saddleback's first mental health conference that they had, and Kay Warren had ordered one of my books and then asked me to come out and speak, and I've gotten to know them somewhat. I know her better than I do him. But here's the deal. Whenever you go to a mental health conference, it's always clinicians, and it's the parents of the child who doesn't get help, or the spouse, or whatever. And I liken that to, my wife had breast cancer about 12 years ago. Today, or this week she found out she has to have the implant replaced because the implants are causing cancer. And so she has to go through the surgery, part of it anyway again. But when she was sick, I felt like I was going to, when I went to some of these mental health conferences, that it was like going to a thing about breast cancer, and the doctors talked about it, the nurses talked about it, the social workers talked about it, and the husbands got up and talked about it. But no one that had survived breast cancer got up and talked about it. So the voice of those of us who have mental illness has to come forward, because we are the loudest voices of hope for those who have it. So that's what Fresh Hope is about.
Thank you for sharing that. It's great.